Hello, everyone, and welcome. I am Estela Mata. I am one of the co-founders of Looms for Lupus, and I welcome you to our symposium, our virtual symposium here hosted by Looms for Lupus. Looms for Lupus is a nonprofit organization that was created and founded by my sisters and I when my sister Juana was diagnosed with lupus. And we are glad to be here. We provide support not just for those individuals that live with these conditions, with lupus or any overlapping autoimmune conditions, but for the whole community, because we know how important it is to connect, to get informed, and to be able to understand and get the treatments that you need for a healthy life. So we are excited today to bring on a free virtual symposium for everyone. So please share if this is the first time you join on Facebook Live. There's a share button. This is going to be an interactive session. So I welcome all of you to put in your comments. I am going to now just bring on a couple of people shortly. But before we do that, I do want to let you know that this symposium is about healthcare literacy. So first, we are going to bring on our guest. They'll do a brief introduction. We will start a presentation about healthcare literacy or health literacy. And then we are going to be joined by a panel of patients that have been empowered, have gone through different hurdles in the health industry, and have been able to successfully be part of their treatment plans and be able to adhere to their treatment. So we'll hear from them, and we hope that we encourage you to stay on for the whole session because we do have some giveaways. So I do want to thank our sponsor. Our sponsor is Aurinia Pharmaceuticals. We thank you for your support and for always being there for our community. They have been very supportive about bringing education about adherence to treatments, specifically to the lupus community. So we do thank you for that. They do have a treatment for lupus nephritis, which is a lupus that attacks the kidney. So thank you, Aurinia Pharmaceuticals. And I am going to bring everyone on so we can welcome everyone to the live stream. So give me 1 second as I remove my banner here. There you go. Welcome. Hi, Silvina. Hi, Christine.
Hi, everybody.
Hi, Juana.
Hello.
So welcome to the symposium. And so what we're gonna do is we are going to go around and give introductions. So we will start with you, Silvina. If you can just please introduce yourself.
Sure. I'm Silvina Martinez. I am a public relations consultant specialized in health and healthcare and multicultural communications. My work has allowed me to participate in health initiatives designed to promote health education, especially in underserved communities.
Thank you, Silvina. And you're going to be presenting for us on the topic of health literacy. So I know that that is very important in our community. Christine, would you like to introduce yourself?
Sure, if I can find that mute button. Good morning and welcome, everyone. I'm Christine Von Raesfeld. I'm out in a parking lot right now, so excuse any noise in the background, but I'm founder CEO of People with Empathy. We're a nonprofit geared to really breaking down those silos in healthcare and really just trying to empower people in their own journey. So happy to be here, as always.
Thank you, Christine. And we know that you are one of those patient advocates that has sit into so many different roles, and we welcome you to hear your perspective about your personal journey today. And we're happy to have you. And Juana, can you please introduce yourself?
Hello, everyone. I'm Juana Mata. I am one of the co-founders of Looms for Lupus. I am also a healthcare advocate, patient advocate, and I'm happy to be here with everyone.
Thank you. So please, for everyone that is watching, know that I want you to pay attention because we are going to be giving a couple of gift cards at the end. Yay. It's the time for giving, right? We have to give back. We want you to focus. We want you to pay attention, and we want you to learn, because I know that if you learn something, you will share it along with your other community members. So it is very important for you to just kind of keep an eye on a couple of the terms that we use and kind of information that is provided, because we are going to ask you a couple of questions. If you have any comments, please feel free to put them onto the comment section. This is interactive. I want you guys all to feel like you guys are part of this conversation. So please welcome everyone. And here is Terry. So first time here on your live. Thank you, Terry. And so we appreciate everyone that's tuning in. Hello, Yvette. Hello, Chavita. Hola, buenas tardes. He said in Spanish, tenemos una presentación a las 3. So we have a presentation in Spanish at 3 o'clock today, Pacific Standard Time. So we're looking forward to all your comments and interactions. So please feel free to put in those comments. So now what we're going to do is we're going to start the presentation, and Silvina will present on health literacy. So we'll bring you guys back, Juana and Christine. So we'll see you in a little bit.
Thank you. Let me see if I can do this right and share my screen. I am, let me see, share screen. You may, let's see.
I'll remove myself and then I'll
have. Can you see it?
Not yet.
You cannot see? Oh gosh. Hold on.
It's okay. Let's see. If not, I could share it. Give me 1 second and I'll share it.
Yeah, will you please do that? I don't know, because I am sharing here. It's telling me that I am sharing, but I guess I am not. Let's see. Let me try again. Share screen.
It doesn't share it, but let me see if I can share it really quick.
Oh, I am so sorry.
Oh, don't worry about it. We're good.
I thought it was so straightforward. It has been always, and so I didn't even think about checking with you first.
Oh no, it actually it usually does. So
yeah, and share. What else can I do? It says share slides, share video file, share screen. Yeah,
let me see if I can share for you. Give me 1 second.
Entire screen, window.
Here you go. I think I could share.
Can you see mine? No.
I can see the whole presentation. I think if maybe Juana or Christine could let us know, or the audience.
So do you see now my presentation?
I see. I'm sharing the screen.
Oh, you're
showing yours. Yeah.
So let me see.
Yeah.
Okay. I'm sorry. I apologize for that.
No, you're good. Just let me know as like next slide.
Sure. So we can talk for hours about health literacy, but the idea here is to take just some time to give an overview. I would like just to give you all an overview of what health literacy is and why it is important. So next slide. So what is health literacy? Can you move? Can we move the slide? Hello?
I can hear you, Silvina. It's already in the what is health literacy.
Okay, so what is health literacy? Health literacy is defined as our ability as individuals and patients to find, understand, and use information about health, our health, and services in order to be able to make informed decisions and act on that information for ourselves and others. Now, the next slide is going to show that the definition of health literacy really has expanded. One back, please. It has, oops, I don't know where we are. Can you go one back? 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 Okay. I'll continue anyway. So the definition of health literacy has expanded now, and as the system becomes more and more complex, the definition of health literacy has expanded to include organizational, not just personal health literacy, but organizational health literacy, which means the ability of the system and different organizations to share information and make it easy for patients to have access to that information and be able to understand it and use it. Basically, what this means is health literacy is a two-way street. All of us as patients should work on our health literacy, should improve it every time, and so does the system and all the organizations that are involved in healthcare. So, what are the factors that influence health literacy? There are individual factors, socioeconomic status, educational levels, demographics have a lot to do, and probably what has more to do in this case is cultural factors, and we can get into that more, but there are language and cultural barriers that sometimes are hard to overcome to inform ourselves and learn and interact in the healthcare system. So why does health literacy matter? Why is it so important? It is because it gives us the skills that we need in order to interact in a medical center, in a healthcare setting, in a hospital, in a doctor's office. It is also important to be able to get information from providers and verbally or in writing and be able to understand it and, as I said, make informed decisions. Otherwise, it's kind of dangerous. It's all about your health. But health literacy is also important beyond what is medical specifically. It is important because it allows us to better be able to navigate the healthcare system, which, as we know, is not always very easy. So, what impact does health literacy have, and how does it impact a different number of things? First of all, it has an impact on preventive care. And this is more important. This is really important because it has an impact on how we understand prevention, how we understand how important prevention is, and to know how, where, and when have access to preventive care. It has an impact on how able or not we are to manage a chronic condition. It has an impact on how able we are or not to manage medications, adhere to medications, and comply basically with the treatment. It basically then low health literacy does result in poor health outcomes. That's the bottom line. And what does that look like? It can result in more hospitalization. People with low health literacy will see more hospitalizations, more readmissions to the hospital, more use of emergency care, and ultimately, unfortunately, even higher mortality rates. That's how important it is. So, health literacy is all about understanding your healthcare options. Now, more than ever, with the advance of medicine and the new treatments that are being developed, we do have options, and it's important to be prepared and informed in order to understand those options and make a good decision. Uh, it is about taking an active role. I mean, it's important that you have a conversation with the doctor, that you are able to partner with your doctor, armed with a lot of information, but make that decision making not just yours, not just your doctor's, but it has to be as a result of conversations that the two of you have, because there are options and it's important to be informed in order to and understand those options. Of course, it is about accessing health information and health services, obviously. It's about engaging with health education and promotion. And that basically is engaging in learning. We need to learn, and it's an endless process, it never ends. Just learning about your specific condition or anything else that's specific to you and what you need, and also learning about the health system and how to overcome obstacles that sometimes come up that may interfere with our access to care. And it is, of course, understanding our treatments and complying with those treatments. So we do talk a lot about health disparities, and low literacy really is, when we talk about health disparities, we talk about a lot of factors that influence that. But I haven't heard a lot about low health literacy, which happens to be probably the biggest indicator of healthcare disparities, the biggest contributor to healthcare disparities, more so than race, than socioeconomic status, and even educational levels. That's how important health literacy really is, and we need to take it seriously. Probably one of the things that helps us the most, that health literacy allows us to do, is become our own health advocates. You have to advocate for yourself always, but now more than ever. If you go through the healthcare system, you'll see that everybody has limited time for you. If you go to the doctor, doctors have limited time. If you have questions and you deal with other professionals, they have limited time. So being informed and being educated is what will allow you to maximize the time that you have to interact with the healthcare system in general. It's important, when it comes, and I know others are going to talk more about health advocacy, but it's not only, you can only become an advocate in your conversation and your work with the doctor, but also in the healthcare system in general. And it will help you know enough so that if you're not it's important to know your rights as a patient. When you know your rights and when you're informed, you're very well prepared to overcome obstacles that may come up. You need a referral, the doctor or the insurance company denies the referral, or there are a lot of different things. If the insurance decides not to cover decide not to cover your care, all are those things that do happen. Although when it comes to insurance, it's another story, and I think most of us just learn as we go. But the more we can inform ourselves, the better prepared we're going to be to make good decisions about our health, and make sure that we do get the care that we need, the treatment that is best for us, not let anybody else alone make that decision. For that, of course, that's why health literacy is so important. We need to inform ourselves all the time. Maybe we can talk about this later, but another big question is, where do we get the right information that is accurate, from sources that are credible and that are reliable? With COVID and the vaccines, we have been bombarded with a lot of information all over the place. And it can be overwhelming and it can be very confusing. And not all the information that we see out there is necessarily accurate. So it's very important to know where to look for that information. And sometimes your patient advocacy group can be a great source, but there are many others. So what health literacy allows you to do is basically to take charge. And this is what it's all about, and let's just take an appointment with the doctor, which is only a very first step. There's a lot more that comes after a doctor's appointment. But what do you need to do before a doctor's appointment is important. You have to prepare yourself. And how do you prepare yourself? Probably it's a good idea to take notes about everything that you're concerned about, all the questions that you have about your symptoms. Sometimes it is uncomfortable to share some information with the doctor. But if there is one person in the world with whom we need to be honest, that's the doctor. Because if we do not provide the doctor with all the information about our symptoms and everything else, he or she will not have what he or she needs in order to come up with the best treatment for you. So even if it doesn't feel comfortable, share everything. And health literacy also allows us to know what questions to ask. That's very important, to know what questions to ask. However, some people do know what to ask, but they don't feel comfortable asking, period. And that's a mistake. Always ask. There's not such a thing as a stupid question. In my particular case, I am every doctor's nightmare because I ask and I don't leave the office until I have gotten all my answers. But it's not that easy for everybody. So that's why just understand, ask questions. There's not such a thing as a stupid question. And if you do not understand the answer you get, you just ask again. It's important that you understand what they are telling you. Taking notes during the appointment with the doctor is very helpful. However, sometimes you're trying to focus on what the doctor is saying, you're trying to understand what the doctor is saying, and you're hoping you will remember everything. So, plus, taking notes, if you have someone that can come with you and take notes for you, that is very helpful, something that is important to consider as well. And before you even leave the doctor's office or the hospital, make sure you do have a phone number that you can call if you have more questions. Many times it happens that, you just forgot to say something or forgot to ask a question, which is why taking notes is so important. But even with that, sometimes something, you may still have something that you didn't talk about, and so you can call. And also remember that nurses and pharmacists are usually very good at helping patients. So don't forget that. You can get really good information from them as well. So basically, health literacy is so important. Without health literacy, you're putting your health at risk, really. Because the decisions are going to be made for you. And there's nothing more important than your health. So educating ourselves, informing ourselves constantly, because things change all the time. Every day we have new treatments and therapies available for different conditions. So it's a lot of work sometimes, but you're going to be focusing on your condition. Health literacy will definitely help you manage a chronic condition. That is not an easy thing to do. I know you all out there know this more than I do. So I think that you get excited about this. I would love to hear your experiences and your questions. So I think Estela
Yes. Hi. Thank you so much, Silvina. And we apologize for all the technical issues we had with the presentation. However, we will be providing the presentation to you all. It will be posted on our website after, but everything that Silvina has discussed is so very important. It's something that it is very, very much needed. And let me go see if there are any questions, Silvina, and
I
then
want to apologize for my dog that decided to bark the minute we were getting started. I am so sorry.
oh no, it's okay. Everyone wants our attention. It happens with kids and with our little fur babies as well. But I do want to, kind of highlight this. Jorge, he's saying apparently his wife has been living with lupus and he's witnessed the daily struggles. He says, and thank you for joining us. It actually is a very, very important. And as Silvina was indicating earlier, for the caregivers and loved ones also to be informed and to help with the note taking when the patients go to the doctor, because especially with lupus, there's a lot of lupus fog. And let me see if there are any questions on here. And let me scroll down. And then what we're going to do, I'll show you a comment here from Yvette. She says 100% agree. Learn your patient's rights and the best medical treatment. Thank you for sharing this important information, Silvina. Yes, knowing your patient rights. And one of your most important patient rights is the fact that you have the right to ask the questions to your doctors and understand what the doctor is telling you. So it is very, very important. So thank you, Yvette, for joining and for sharing. Christine also shares, knowing how to do your research to separate the mis and the disinformation is so key. That is very, very true. And honesty is the best policy, right? And as Silvina, I think you were mentioning about the embarrassments and stuff. It's okay to feel embarrassed, but sometimes embarrassing questions or embarrassing symptoms that you're having are very crucial to your care and your treatment. So I do encourage everyone to do that as well. And you can also take care of your caregiver, loved one, or someone that trusts your doctors. That's exactly what is needed. So, and here's Lupus Spoons also sharing, that a caregiver is listening. So I don't see any. Here it is. Terry shares, it's difficult at a time because doctors are always in a hurry to get to the next patient. So if you want to kind of share a little bit of that, what do you do, or what do you recommend, Silvina, for people to do if the doctor is in a rush to,
Yeah,
go
that's a great comment, because it is so very true. Doctors more and more have very limited time. You want to get mad at the doctor, but it's just part of how the system works nowadays. And that's why preparing and being informed is so important, because you want to optimize that limited time that you spend with the doctor. It's just such a valuable time. It may be only 10 minutes when you need 20, but how do you optimize your time? You do it by preparing yourself, reading, get information about your condition, get your questions written down. If you don't prepare and you don't write down, honestly, it has happened to me way too many times, you just forget. You forget because there's a little bit of a stress. You know that the doctor is in a hurry, and so you just get all stressed out or worried, and you just don't ask the questions. Don't be afraid and don't be embarrassed to bring, your notes with you. I said, doctor, I have taken notes, because if not, I am going to forget, and I want to make sure that I can ask you all these questions. So that's how you deal with the limited time that you usually have with the doctor.
Yes, and also Yvette brings up a great point. Sometimes what you have is patient portal or access to your medical records. So if you go on there, it'll tell you your previous lab results, so you could prepare for your appointment as well, and writing down the information. Definitely. I do have here, hi Kay. She said she recently had a change in one of her test results, and she reached out to support group leaders for help and questions, and that she really should pose it to your doctor. Yes, it is good to reach out to people that live with these conditions, but most definitely always go to your doctor. She says she received many great suggestions that allowed her to better understand the results and what they meant. One unique thing with lupus patients is that everyone is so unique. It's like you're like a snowflake. No two cases are alike. So it is always very important to highlight the part that we here are just providing you information. It is very important. Any information you gather from social media, from your support group leaders, from other patients, always go back to your doctor, because they're the ones that are treating you. Yvette says that she used her patient portal. Yes, that's again amazing. Christine adds, to utilize the staff to optimize your time with your physicians by sending emails beforehand and addressing issues. That is a good way to do it. Not every doctor has an email, but that responds to it, but it is good to always look and ask your doctor before you leave the office. Do you guys have an email address? Is there someone that I can reach out to? And Terry says that she does have a list of the questions. So that's amazing. Juana agrees with, the questions. Yeah, the My Chart. My Chart is kind of equivalent to like a patient portal. So it gives you access to your chart from your home or from your computer. And yes, Lupus Spoon says that she loves using it. So what I'm going to do is I'm going to bring back Juana and also Christine. And what we are going to do is we are going to kind of combine everything we've been talking about when we as patients have to deal with real life, right? I know it's always so important to, kind of, I think someone has background noise. I don't know who it is. But one of the things that I wanted to, I think somebody has like a background noise. I don't know if you guys can unmute it. So I don't know if you guys can hear me right. I think we're good now. Okay, we're good now. Perfect. So we have Christine and Juana back, and Silvina's going to stay on just in case we have any questions for her. But Juana and Christine, both of you guys have been diagnosed with multiple diagnoses, and both of you have encountered perhaps different situations. I know your stories are very unique. So I do want to ask you guys something. So the same question for both of you guys, and we'll start with you, Christine. When you were first diagnosed with your condition or conditions, did you face any obstacles in accessing care? And did you understand what was going on or what was wrong with you? Or did you even know what your diagnosis was or what it meant?
Okay, so you're starting with me and you can hear me okay?
Yes.
So, again, in a parking lot, so excuse any extra noise, but I got diagnosed young. I've been sick most of my life. At the age of 14, I was diagnosed with a rare bleeding disorder, which kind of led me into my journey of lupus and autoimmune. And I didn't have any resources. I didn't have a really good support system. I did have some amazing doctors that were able to walk me through things, but at 14 years old with no internet, I was taking the bus to Stanford and sitting in the medical library, actually looking up my conditions and trying to find out what's wrong with me. And so, from there, I'm on Medicare. That's been extremely difficult, trying to find out how to navigate through this system and really get your care. And, it wasn't easy finding any options. And really, it's been years, and I'm in my 40s and still struggling. So I think it's one of those things that takes time and takes you really knowing your body and yourself to really be able to advocate for things. So it was difficult, but there are things out there and ways to, build up your network and find the resources. But again, you talk about finding misinformation and disinformation out there, and it is a struggle, especially right now with COVID. So I don't know, Juana, you want to touch on that as well? You're muted.
You're muted.
Yes. Thank you, Christine. As for me, I did have to go through some struggles before my diagnosis. Before my diagnosis in 2008, I started having a lot of problems, and I kept going to the doctor. Nothing was said. Every time I went to the doctor, they said I was fine. I didn't have any problems, any health problems, other than my hair falling, rashes on my face. So I insisted. And I knew something was wrong. I knew my body, or I know my body actually. And so I insisted. And the day that I was diagnosed, actually, I also faced many struggles. The doctor dismissed me. He said I looked fine. I asked for lab work because I knew something was wrong. I ended up getting the lab work, not like I had asked. I had asked the doctor to see if I could get my results the same day. I was told I wasn't going to be able to get them. I was actually diagnosed with anxiety disorder, but I insisted, persisted. And as I always say, we are the CEOs of our bodies. We know when something is not right. I did get the blood work done, and after several hours, I did get my results. Unfortunately, that day, my playlists were very low. And what I say always is that we are our own advocates. We have to do what we feel is right. And at that moment, the right thing for me to do is to insist about knowing what was wrong with me. If I had left to my home that day, like the doctor suggested, I would not be alive today. So it is important to advocate for yourself. And as far as a diagnosis, I didn't know what lupus was the minute I was diagnosed. I was placed in ICU because I was critically ill. And no, I did not know what lupus was until I researched it with my sister's help, and family support is great. So I did have my family support. I had my sister there with me who helped me not only understand a little bit more what was going on with me, because at the moment I didn't know what was wrong. Though I knew something was wrong, I didn't know that I was critically ill.
Can I touch on one thing that you said there, Juana? And I just want to say that there's so many of us out there watching this that look healthy and look fine. And I'm sure a lot of us have been sent to the psychiatrist because they can't find anything wrong. And so I just want to say to those people that look fine and that look normal and look like you are pulling it all together, there are still struggles for us. And it's okay that we struggle as long as we do it together, and then we know that there are answers out there. So I want to say, that whole point of us looking good is a huge factor when it comes to these physicians sometimes, because, I go to the doctor with my makeup fully done and all of these things and wonder at times, should I be making myself look horrible just so that they see it? And so I think it's just really important to know that just because you look a certain way, you may feel a whole nother way, and that's what's more important. So just wanted to touch on that.
Thank you, Christine. And I totally agree with you. But again, it is important for us patients or everyone to understand that the communication with your doctor is very important. Yes, they can tell you that you look fine, but again, we are the CEOs of our bodies. We only know when something is not right. So it is important for us to insist if we have to, because at the end, it is our health. And for me, if I had listened, if I had agreed with the doctor and gone home that day, I would not be here today. So it is important. Of course, the doctors deserve all of our respect. They are the professionals. But we need to explain and advocate for ourselves, because it is our body, it is our health. And we can possibly die if we don't get the treatment that we need right away. As for me, if I had gone home, I would not be here today.
See, just one thing, that's pretty amazing. And I admire you both, really. It does take a lot. And this is a point that I want to make. It does take a lot to insist, to ask the questions, to not take no for an answer, to not go home. But not everybody, especially when you are in such a vulnerable situation, when you're sick, you're worried, you're concerned, and to have the strength to stay with it like you guys did is not easy, and there are a lot of people that just don't do it. um, and I understand why they may not do it. They are scared, or they don't have enough information, and so, like you say, if you had not done what you did, you may not be here today. And I can assure you that a lot of people are not here today because they didn't take charge. Sorry.
Yes. No, that your points are so valid. And I think one thing that I have to say is validation is key. Feel validated. Don't let anyone dismiss you. I know it's hard. We have so many barriers. Some of us have language barriers. That is why we need to make sure that we don't leave that doctor's office without completely understanding what our diagnosis is, what our next treatment plan is, what is our treatment about, how are we going to be taking that, what are the next steps. And if you don't remember to ask at that moment, go back home and share it with someone, with your loved one or with your friend, so that way you guys can go over it and understand and go back with any questions that you may have. So I'll go to the next question. Do you have any tips for someone who was recently diagnosed with a chronic or autoimmune condition? So think about the first day of your diagnosis, and what tip would you give to that individual that may not have heard about the diagnosis that they're getting? Christine?
So I think one of the first things I would say is understanding how to relay your symptoms to your doctor. When we talk to our physicians, a lot of times we expect them to know what we're going through. And we say, a lot of times I've heard people say, I'm in a lot of pain. Well, what does that mean to you? What does it actually limit you from doing? And how do you, manage throughout the day? And I think one of the other things that I've learned is really forming that relationship with your own physician and asking them, what do they need you to do to keep you at your best quality of life and your best care, right? Because if there are things that you can be doing, I'm in heart failure, and I recently, had a strained relationship with one of my cardiologists that actually came out as an amazing relationship after I was able to sit down with him and ask him, what is it that you need from me to ensure my care? And that question alone changed the conversation and the relationship with that physician. And so I think it's just really important to establish that relationship with your physician, to be honest about things and to be honest with yourself. I know that a lot of us will take a drink here and there, or we'll do something, and we won't tell our doctors, but those are things that are extremely important, especially if we're on drugs that are here to treat our conditions. So my advice is really form those relationships, learn about how to describe these things to your physicians in a way that they're going to understand you and not dismiss you. And that would be and fight for yourself. Something is wrong. If there is something wrong and everybody is telling you that it's okay, and you still know or still feel that there is something wrong, keep pushing. If one person doesn't listen, there is another person out there who will. And so I think that's the key.
I love that you shared that, Christine, because I think communication is key. Juana, how is your relationship with your providers now, with your specialist, with your general practitioner? How is that relationship going? I know you had difficulty that first visit when you first had your diagnosis and you were being dismissed, but how is it now?
Definitely. And I loved what Christine said, that communication and the relationship with the doctor is important. But one thing that I would tell a newly diagnosed patient is that they are not alone, that there's people out there that are there to help. So that would be one of the things that I want to make sure for newly diagnosed patients to reach out for help. and to know that they're not alone. There's help, there's support groups, and support from family members, loved ones, or friends. Just reach out for somebody to help you. And as far as the relationship that I have with my doctors now, it is very good. I found out that having that communication with the doctors, coming up with a plan together, will actually help patients, helped me to stick to the treatment plan that we planned together. With my help, my doctors, we came up with a treatment plan that works for me. So I communicate via emails, and I get a fast response. So that communication is very good, and it helps me. It has helped me manage and be where I am today. So the communication is key.
Thank you.
Can
Christine.
I was going to say, can I touch one thing really quick? Is Juana said, ask for help. And you guys all know I struggle with that one. And that is a huge part of dealing with any illness, right? Is really that you aren't alone. And I think all of us, even when we're dealing with our most dire situations, we kind of put ourselves into a bubble and escape, right? But I think that is key to know that you have these people out there who are going through what you've been through, and that can relate as a friend, and I think that's important as well.
Definitely. And another thing is understanding your body, your normals. That's one thing that I think is important too, because like Estela said, we all lupus patients are like snowflakes. We're all different. There's no two patients alike. We have to learn about our normals. What might be normal for me might not be normal for Christine. So we're all different. So we need to learn about, what's my normal temperature, what's my normal heart rate, what's my normal, what your normals are. Learn about your normals. I can tell you, when I was first diagnosed, I had thrombocytopenia, low platelet count. For many years, my normal platelet count is 130. My normal was below 100, not lower than 50, because then I would go into ICU or be critically ill. But understanding what your normal is also important.
Yes. One thing that you guys were both mentioning is the communication and the planning of the treatments and being part of that care team. Christine, how do you keep track of your treatments? Do you adhere to your treatments? How do you keep yourself accountable, or how do you and your doctor continue to have you accountable for your treatments?
So I've not always been good at this. I haven't been. I'm in my 40s, and I'm just starting to now realize the importance of compliance and the importance of, of even reporting adverse effects. And we're learning all of these things as we move further. And I totally just forgot what your question was.
Adherence to treatments.
Adherence to treatments. I'm learning, and I think a lot of it has come into the play of, I educate myself around the precision medicine aspect of it in the future, and really knowing what the science is and what's involved. And, I've talked about it before with precision medicine, that I've had access to some testing like pharmacogenomics, which has helped me tailor my own treatments, and really, has stopped some of the side effects with some of the drugs that we would have been trialing. And so there are options out there. And I think it's really important to do that research on what's coming out. Like Juana said, we and Estela, we're all different. I metabolize drugs in a completely different way than other people do. And that is one thing that I think as patients we need to look at. We need to look at individually, how do we do these things? How do we metabolize? Juana, you mentioned your normal numbers for you may be completely different for someone else. I have my spleen removed, so my platelets are consistently at 400, which wouldn't be normal for anyone else, but is normal for me. So learning those ins and outs, the science of your condition and how you're reacting to things is also, I wasn't a student. I wasn't a science person. I hated education in school. But now that I know there are things out there that could potentially benefit me, that could improve my quality of life and my care, those are things now that are fascinating to me. And I think that's where we need to look is what is actually happening to us individually, and really tailor that to ourselves.
Yes, and you just put this out perfectly, Christine. You touched on a couple of terms that maybe a newly diagnosed patient or people like me that may not, understand what precision medicine is. What are your options? We have so many options in healthcare for us to, for both our physical and our mental health. So it is so important to look at all these options. So we will have another session just to talk about pharmacogenomics and how your body metabolizes these treatments or medications. We're also going to talk about precision medicine, which is specifically to tailor to your specific needs and how your body is going to be reacting to the treatments. All of this is health literacy. And I bring this up because I did not know a lot of these terms myself a couple years ago. I learned it through Christine, and she learned it through talking to her doctors, through being in the healthcare system that allows her, and the providers that give her this information, and her friends. So it is very important to keep your mind open, to stay connected, to watch sessions like this, because you will learn new things. The reason we do this is because I know I needed this. My sister needed this. My family needed this. We know our community needs this. We need to inform each other because we don't know sometimes where to go. And if we are on Facebook asking for treatment options and to connect with friends and to see how they're doing, we could most certainly learn a thing or two about how do I take care of myself? How can I prepare for my doctor's visit the next time I go? What is this whole pharmacogenomics things? Why does this treatment work for me and not for her? So all of these things are very important. So I do want to ask both of you, well, actually all three of you, because Silvina, I want you to answer this one too. Do you guys have a phrase or a word that keeps you guys either going or pushing forward, or that makes you want to continue to learn more about getting treatments for yourself? So we'll start with you, Juana, and then we'll go to Christine and Silvina.
A phrase.
A phrase or a word?
A phrase award. Well, I just have to say our Looms for Lupus slogan, because I think I go by that. And the phrase would be never give in, never give up, never let go, just keep fighting. And that would be my phrase, because we have to continue going. We have to push it. We have to continue the fight, and we can never give up.
Yep. Christine?
So I've got someone in the background, so hopefully you can still hear me. My phrase is the same as what I always do. It's only through collective intelligence and collaborative leadership that we'll find viable solutions that work for us all. And so really for me, it's about all of us talking, right? Sharing our experiences, sharing what's going on, and looking beyond the condition that we're dealing with, and looking at us as people and the symptoms, what we're dealing with. And so really, it is, for me, the key is that whole collective intelligence and learning together and learning to share this.
So shortly before my little phrase, I just really want to congratulate you to, it really is very humbling to hear you talk. You have become experts on your condition, and you are just so in charge. And I cannot imagine that that's easy to accomplish. So congratulations. And I hope that your experience helps others get motivated to do the same thing. For me, it's about your life. It's about your life. I mean, what can be more important? That's my little phrase.
Wow, that is so deep. It like all sunk in. It is so true. It is about our lived experiences, what we yearn to learn, how to take care of ourselves, and connecting with others, and sharing what we've learned with others, right? So I think it is amazing that we are all coming together, because that's how we learn, right? We learn from each other, and we advocate from each other. We advocate for each other, and we empower one another. And that is what we look for every time we do these symposiums, every time we connect with someone at the supermarket, with someone, with our neighbors, with our friends. So I'm just so grateful to the three of you for sharing your knowledge, for sharing your story, and for contributing to the wealth of information that we're providing for our communities, to empower them to take charge. And I know this, Christine, you had, on your whole advocacy campaign with the patients like me, is take charge. That's what it's about. It's about taking charge of your health. It's about learning and yearning to continue to learn and put things into practice. So with all the people that are actually joining us on the live right now, please put in a comment if you have a question, if you have anything that you would like to contribute or share. Please share that now, and and we'll bring it up on the screen so we could all see it. But I also do want to let you know that this presentation will be available. So I will be providing this on health literacy, but also I want you to kind of recap, if you guys can, if you guys are still watching, put in your comments, because we're going to give a $25 gift card to the first person that can answer this for me really quick. So actually, I'll put, give me the first 2 words that you think of when you think about health literacy. And we've been talking about it, and we've talked about tips, and we've talked about it in our journeys. So 2 words that you learned from about health literacy, or what you can do. Let's see.
Hey, while you go through the
so
answers, can I just make one comment?
Yes.
I wanna just say that we all have a chance to improve our own quality of life. And while we're improving ours, we can improve everyone else's. And so I just want to stress how important it is for things like this to happen. And my thanks to you both, or all of you actually, for really tuning in and for engaging in these sort of conversations, because it's so important for all of us.
Yes. And we have Yvette, she says taking control. And Kay is saying take charge. And those are 2 words that we were commonly used, taking charge of your health, taking control. And yes, Terry, educating yourself and empowering yourself. So what we'll do is, I know like 4 people answered, so we'll take the first 2 people that responded, the taking control and the taking charge. We are going to give you guys a gift card, a $25 gift card. So we will mail it to you. So I'll individually send you a private message so we can go over your address and information, so we can send that to you. So
the gift card is to Walmart.
Yes. And this is what it's about. It's about taking charge, and you being here today. Listening, giving yourself the opportunity to learn something new is very important, because it's going to make a difference in your life. So I do appreciate, again, I appreciate Silvina for the presentation, for providing us your knowledge, for giving us information about health literacy, for the tips that you gave us. Also, Christine, for always wanting to share and to learn and empower the others that are, struggling and yearning always for information. And Juana, thank you. Not only are you my sister, you're my best friend, and I go to you and I lean on you to gain a lot of knowledge about what you're going through and what I can help myself with. So I encourage every single one of you to know that you are not alone. Like Juana said, we are here for you, and please connect with one another, empower and support each other. And with that, I will leave you. It is 1:00. I do want to stop on time. I want to give you guys back your time. I do appreciate, again, for everyone that tuned in. And I love that everyone was able to join us. And remember, there's a 3:00 presentation in Spanish. Hopefully we'll get our presentation ironed out. I think I already know what the problem was. So we will have that. And Lupus Poon says, I love that we all can get together and share our experiences with one another. That's what it's about. It's about community and unity in our community. Thank you so much, everyone. Thank you, Silvina. Thank you, Christine.
Good
Thank you,
luck.
everybody.
Next one. I won't be there because I don't speak Spanish, but I know you guys will do amazing.
Thank you.
It's on my bucket list to learn.